name is Brianna Richmond, and I'm doing video skills validation for inserting a Foley catheter. The first thing I would do is always double check the physician's orders, make sure I have the right patient, of course, and I would assess any allergies, if they're allergic to latex or any of the tape or iodine or anything such as that. Next thing I would do is, in the patient's room, I would just come in and explain the procedure, ask if they have any questions or any concerns before I begin inserting it. And then after that, the patient says he understands everything and he's good to go, so I would just make sure the patient is a lithotomy position and that its legs are out. And then I would start my process. So then I would come in and I would put my catheter here in the bed. And I can also, if I decided to go ahead and inspect the meatus and make sure everything is good, make sure I find it too before I actually start the process. So then after this,
close the curtain for privacy.
I would just open my catheter kit here, staying within my 1-inch borders. Next thing I'm going to do is pull my gloves out, put them to the side. Then I would come in, and in my borders I would shake it out, being careful not to contaminate anything. And then I can fold it in, come in. I'm going to lay this under the patient, between its legs, and I'm just going to leave it until I get my sterile gloves on. So I'm going to go right here and put my sterile gloves on. Careful just to Once I have my sterile gloves on, I cannot go underneath my waist, but I can come over here and I can actually position this to underneath the patient's legs, and then we're good to go. This I would not use. Let me just toss that to the side, and then I would separate, or go ahead and get my swab sticks and lube and everything ready. So I'm going to separate this. My specimen cup comes over here. And then after this, I'm going to go ahead and test my balloon.
Mommy! Evan, shh.
And the balloon does indeed inflate. So the next thing I'm going to do is get this iodine swabs ready. And got it on my fingers, so I would just rub it and let it dry really quick before I touch the patient.
I love you.
And then I would get my lubrication ready. Okay, after this is done, I would come in and I would go ahead and remove the plastic on this Foley catheter. Being careful not to contaminate it. And then I'm going to come over here, I'm going to contaminate my left hand, and I'm going to pull apart the labia, and then I'm going to make sure I locate the meatus, and then I'm going to take one iodine swipe, and I'm going to go down the right side, and then toss, and then come down the left side, not to contaminate my sterile field, and then come down the middle, and then come around and toss. Okay, after that it's time to insert my Foley catheter. So I'm going to make sure I lubricate this. There we go. Make sure I'm pulling this apart. I'm also going to put it kind of go above the clitoris and go in an upward angle. I'm going to insert 2 to 3 inches at first. And then once I see urine to start to flow, I'm going to go ahead and insert about another inch. Okay, after this, I can go ahead and I can pinch the catheter, holding it in place. I can go ahead and insert my sterile water, filling up the balloon. And then I can come down here and pull this off. Okay, I would also ask the patient if there's any discomfort or if he's having any pain or anything that he feels he needs to tell me that could be going wrong. Okay, and then after that I'm going to go ahead and I'm going to empty my box and clean up all of the mess. To start it, I would take my sterile gloves off, and then I would then put on clean gloves. And then I would put on a catheter, or go ahead and tape this to the leg at the Y with maybe a catheter strip, and then lower the tube, clip it to the bed, a part that is non-movable, and make sure that this is coiled at the bedside as well with this tied to the leg. And then I would clean up any mess or any liquid or anything that is on the bed for them, or around the vagina. And that is insertion of a Foley catheter.